Hello, this is Dr. Michael Crosby from Dental Town. I'm an orthodontist at Dental Town. I wanted to talk about a question that I get all the time from parents, and that is, when is the best time for my child to see the orthodontist? Um, if you're like most parents, you sit there and just marvel at the fact that you see these second graders and third graders have braces on, and you marvel at that because you think back to your day, and it wasn't until 8th grade, ninth grade, sometimes even later, before you got your braces on. And so a lot of parents ask, well, is it necessary for my second grader, my 7-year-old, my 8-year-old to see an orthodontist? And so I wanted to talk about that. The short answer is it's important to bring your child in to see the orthodontist. In fact, the American Association of Orthodontics, the AAO, which is the National Foundation of Orthodontics in the country, they recommend that you bring your child in at age 7 to see the orthodontist. And so why is that? Now don't worry about that. Most of the time we just look and kind of talk to you about what we see, what our findings are, and don't recommend treatment. But it's good to just know that an orthodontist has looked at your child's mouth. Every once in a while, though, there's a situation that comes up that is actually really necessary to treat at age 7 or 8. There's a huge benefit to treating at age 7 or 8 versus waiting until age 13 or 14. And a lot of these have to do with bites, with the shape of the actual jaws. You hear the phrase crossbite, or an anterior crossbite, which is just a crossbite in the front of the mouth. Some people call that an underbite. It's kind of when your bottom teeth are out in front of your top teeth. Some kids suck their thumb, and that can change the shape of their jaw. These are issues that are actually really important to start correcting at age 7 or 8. And if you wait too long, you lose the ability to fully correct these things. Even if you wait just until age 12 or 13, you lose the ability. And so it's nice to have an orthodontist at least check and see if your child has one of those conditions, and if so, then it is necessary to treat it. Now, most of the time, kids come in and their teeth are just crooked. Their jaws are fine, their mouth is fine, their bite is fine, but their teeth are crooked. And so in a situation like that, treatment's not necessary, but a lot of parents still want their kids to have braces because they want their teeth to be straight. And so we end up putting braces on at age 7 or 8 just to straighten the teeth. And that's really more of a preference from the parents. And so treatment, when you see a child at age 7 or 8 with braces, that's called a phase 1 orthodontic treatment, because almost always they're going to need braces again when they're 12 or 13, when all of their permanent teeth finally come in, which is around age 12 or 13. That's when they'll need a full set of braces. And so the question of, does my child need braces, or do they need to be seen at age 7 or 8? The answer is yes, bring them in to see an orthodontist at age 7 or 8, but not necessarily. In fact, most likely they won't need braces, but it'll be good to talk to the orthodontist just to see what's going on in his or her mouth. Thank you for watching. We'll see you next time.